All right, good morning and happy new year to the entire coalition. This is Phil Pugh. We're going to go ahead and get started with our monthly coalition call. As an administrative reminder, please do not put us on hold. If you have to go on hold, try to hit mute so we don't hear Yanni or some other great elevator music or whatever your organization likes to play in the background. I like to hear a little bit of Bon Jovi if you are familiar. Also, again, this is being recorded, so this is your last opportunity to jump off the line if you object to being recorded, and this will be uploaded at a later date and time, or uploaded today for your review at a later date and time to our YouTube channel. So we're going to go ahead and get started. Just as a friendly reminder, if you are a hospital here in the coalition, you need to have an IMATS account. So quick question, when's the last time you logged into your IMATS account? Make sure you have an active SAMS.gov account. If not, if you don't log into that over the course of a year, they will suspend your account. And guess whose account is suspended currently? Because I am 2 months outside of a year from going into IMATS, yours truly. So I am in the process of repairing that now. Luckily, Lee's account is still active and a few others here at the hospital. So I'm working to get that fixed now. So don't let it be you. We'll go ahead and do a quick roll call. We'll start with our hospitals. Anderson Hospital. Alton Memorial. I didn't get Anderson, so I'll go on to Alton Memorial.
Hey, Phil, it's Brian. Also, while I'm here, I want to go ahead and make the announcement. We have a new environmental health and safety emergency preparedness manager. His name is Aaron Rogers. I will put that in the chat as he's getting settled in this week. He's here listening, but moving forward, he'll be joining these on his own.
Perfect. Thank you and welcome, Aaron. Over to Boyd. Anyone from Boyd on? Okay. Carlinville Area Hospital. How about Staunton? Fayette County. Gateway Regional.
Gateway Regional's here.
Gotcha, that Rick? Rick, was that you just checking?
Yes, sir, that's me.
Gotcha, thank you. Our HSHS partners, Holy Family.
I swear to God, they are so lost. Like, if that's really what they're worried about right now, they need to.
How about St. Elizabeth's?
St. Elizabeth's is here.
Feel free to have her contact her directly if she's concerned about it.
How about
I did
Breeze?
meet Steve on the phone yesterday, and
Breeze is here, Margie Berry.
Thank you, Mark. Highland?
Tim Claxton is here with me for St. Joseph's Highland.
Stuff over there, to be honest.
Thank you, Brad. Jersey Community Hospital. From Belleville, you got myself, Mike Gilbert, Eric Perham. Lee is out currently, but he'll probably be joining us in a little bit. And for Shiloh, so we're all present and accounted for. How about Memorial Hospital in Chester? How about St. Anthony's?
Gary's here.
I'm sorry, was that you, Gary?
Yeah, that's me. I'm not feeling really great, but I'm here.
Okay, I got you. Thank you. Redbud Regional.
Tara's here.
Gotcha, Tara. Thank you. Sparta.
Dan's here, Phil.
Gotcha, Dan. Thank you. And Touche Regional. Anyone from Touche? Nope. Okay. How about Bond County? Local Health Department.
Terry, I'm here.
Gotcha, Terry. And while we're here, I'm going to pause just for so I don't miss this, but Terry has decided to retire again. I'm gonna give him an opportunity to talk while he's here, but he's decided to retire again. So I wanted to take an opportunity to thank Terry for all of his work here in the coalition. He's had to pick up some extra spaces here and there. Done great work and assisted us on the executive committee with reviewing project proposals each year. So Terry's been a great pleasure to work with you over these last 5-6 years or so. So you will be missed. And again, we super appreciate your time and support. I'll pause right here just in case you want to say something to the group.
Yeah, again, thanks everybody for all their help while I was representing. And Molly Peters from Greene County has agreed to take my place if that's okay with everyone.
Indeed. So, and part of what we're discussing, and as far as taking place, yes, as far as holding as a position on the executive council, she would be definitely welcome. Officially, we kind of have to put that up to a vote. If anybody would like to submit a name at this point in time, you are more than welcome. So I'll pause for that.
This is Terry. I will.
Okay. So would anyone like to second Molly's nomination for fulfilling Terry's spot on the executive council?
This is Gary, a second.
Thank you, Gary. And so we'll take that to a vote, and we'll do this by, I guess, abstention. For those who disagree with that, please make yourselves known. All right, as unchallenged, I will say thank you for the committee. The ayes seem to have it. Molly, thank you for stepping up. And we look forward to working with you because I got some work for you to do. How about that? Just kidding. So thank you very much for stepping up. And again, thank you very much, Terry. I'm sure you'll find some good opportunities to go fishing or whatever you want to do.
Can they test you there?
In your
Can
next life.
tell them you were exposed and have them test you there. I mean, you don't want to expose your patients.
All right, we'll move on. Calhoun County. Okay, how about Clinton County? Eastside Health. So we've got a lot of folks on the line, but not a lot of folks here at the same time. I know it's still around holiday season. How about Fayette County Health Department? Greene County? Jersey?
Jersey's here.
And who was that?
This is Heidi Carter.
Thank you, Heidi. I just want to make sure we get you recorded, so thank you. Macoupin County.
Hey, Phil, it's Derek.
Thank you, Derek. Appreciate it. Madison County. How about Monroe?
Vicky here.
Gotcha, Vicky. Thank you very much. Randolph County. And St. Clair County.
Hi, it's Kara. I'm here.
I saw you logged in, Kara. Thank you. Our community partners, RMSC. Greg, are you on?
I am on, Phil.
Thank you. Our emergency response coordinator, Beth, are you on?
Hi, Phil. Beth is here.
Gotcha. Thank you so much. Any of our BJC partners? Nope. Any other emergency management agencies local that may be on that did not get called out?
Yeah, Scott is here.
Gotcha, Tim. Thank you. I got a whole section for you guys, but I'll take you now. All right, MedStar Ambulance.
Good morning. I'm here, John.
John, thank you. How about Abbott? No Leslie this morning, okay. And Slew, I know Helen's here. I've seen her live
Hi.
a couple times.
Good morning, President.
Gotcha, Helen. And again, we had Scott Air Force Base and any of our STARS partners that are on. I think I see a few in the group.
Hey, Phil, it's Sam.
Gotcha,
Brian
Sam.
Marler's
Thank
here.
you. Who was the second person? Sorry.
Brian Marler as well.
Gotcha, Brian. I see you. Okay. And any alibis, any folks that maybe couldn't get off mute in time or didn't get called out?
Paula with Illinois Primary Healthcare Association.
Thank you.
Danielle?
Lloyd Hospital here.
I'm sorry, who was that? Is that Nancy?
Lloyd Hospital.
Yep, gotcha, Nancy. Thank you.
Columbia EMS.
Columbia, thank you. Who was that? Specifically, as far as the name.
Kim Lambrecht.
Oh, gotcha, Kim. Thank you.
Danielle from Gateway Regional.
Gotcha, Danielle. So you and Rick. All right. If in the end we get through, you didn't get a chance to get off mute, just put something in the chat and or just shoot myself or Lee an email and we'll make sure that we got you covered. So, and welcome to our monthly update or meeting. Here's the basic agenda, pretty much standing. We have a few notable items we want to cover later in the agenda. As far as our regional patient census, this is what the curve kind of looks like today. Well, these numbers are yesterday's. I did not put in this morning's numbers, and I will take a look here in EM Resource while we're talking. But it looks roughly about the same, maybe one or two higher in general. But as you can kind of see, this is we are probably 90% of the way of our highest or our peak census, I would say, in last winter. So this December timeframe, and as you can kind of see, this curve is very steep and just coming off our our downturn earlier or late last year into the holiday months. Really steep. So not that I can, if I can't look in my crystal ball and say exactly where we'll be, but obviously I don't think this is the end of it. I will say I don't think we're peaked yet for this wave. As hospital censuses will tell you, and by the number of times we've had organizations at a peak census, whether that's in the EDs or just in your house here on this side of the river, if that's any indication, we'll probably got another 2 to 3 weeks, probably a heavy load that we're carrying right now, if not more, before we start to see a break. I guess one good thing is if you have not seen any of the St. Louis metro curves on the expansion or the what they'll call, I guess some call the epi curve, for those positive patients or positive citizens here in and around the St. Louis metro East area, that number is at a rate that is extremely high. While this curve and the rate of inpatients looks like it's high, it's almost dwarfed in comparison to the amount of folks that are testing positive across the St. Louis metro East area. So I guess one good thing is that while the number of positives are increasing at a rate much more rapid than our census, our inpatient census, we will still probably exceed our highest peak of last year. So I can say yesterday we were at the highest that we'd had across both hospitals, both Memorial Hospital in Shiloh and Belleville, and Memorial Hospital Shiloh and Belleville. We hit, I think, 88 or 90 patients, positive patients across both campuses, which was high. And I would suspect that the remainder of this week, we're going to probably exceed that right now. So, all right. Let me go on to the next slide. These are your inpatient deaths. As you can kind of see, we did increase on those But the number of cases obviously will probably dictate that to continue to rise. I wish it was a lot smaller, but it is where we're at today, or over the portion of the end of the year. You can kind of see here's our regional picture. We're basically hitting 20% positivity rate, and we've finally broken the seal of the 20% ICU bed availability for our region. As you guys know, last month and all the way up until 4 days ago, we were still above 20% ICU bed availability. On my call this week with my peers, the other regional hospital coordinators across the state, I can tell you, I think even down south, I know we see a lot up north, but even down south, Marion region, they have 88 ICU beds across the entire region. They had 4 available that morning on Monday. So if that's any indication. So a lot of folks are still worse off than we are, but maybe we're just catching the back end of the entire surge at this point. But that's where we're at. Made a 1.65 increase in vaccine rates, which is good. We're slowly moving in on that 50% across the region. Wish it was more, but those are the numbers as of this morning. All right. So with that, and now I'm going to open this up for a little bit of discussion here before we move on into our standard agenda. But given the current surge, and the stresses that hospitals are seeing and our EMS providers, we're going to reestablish our weekly telecons just for, to touch base with everyone. We're trying to keep it as short as possible to basically go over whether it's staffing, equipment, supplies, concerns, whatever you have to bring to bear. We want to get an opportunity to touch base with you and see how we can assist in any way possible that the resource hospitals can assist or assist as the RHCC. I'm going to use the 10 o'clock time slot as the time that we're going to use, same as this one, so as not to fully disrupt everything that we do. And I will basically extend this meetings out. So this exact same number, everything, call-in information will be the same. Okay. And again, it won't be we're not going to do a full formal agenda, but we will use this as an opportunity for the hospitals to relay what's occurring, what are the needs, and how we can support each other in that. I'm also using, so that's going to start again next week. Officially, we'll start again next week. The second part of that is, we talked about this last month, but reporting in EM resource bed availability. We're going to go ahead. I'm going to push forward to have twice daily reporting. The state is probably looking into that. We did discuss it again on Monday with, again, the other regional hospital coordinators. I recommended that we unify on the dates or the times so that, Region 5 and Region 4 and Region 3, we're all updating at least in the same time frame. So the visibility or predictability of the information is there, because that's what we don't have today. On some days, we will have folks update, as early as, like I'm looking right now, someone's updated at 1:20 in the morning. And as we've discussed those, that's, I'm sure, a manpower issue or staffing concern. You want to do it when you're probably least busy, but we want to try to give folks the most accurate information at the time when they need it. So when folks are really getting hit early on, I'd like to be able to provide some clarity to the beds that are available in and around the region, and in the afternoon, because I know when working discharges and all that type of stuff, things do change in the afternoon. So these are my proposed times. I wanted to pause here for the EM resource updates and reports. I'd like to pause here to get some feedback from everyone on what they believe is a good time outside of what I have outlined, because if there is a better opportunity or time window that we can do it twice daily, I'd like to do that, but I want to make sure that I get your feedback. And I know everyone's not going to like what we do decide, but maybe we can, 80% is 100% in my eyes in this regard. So I'll pause here. Any thoughts, concerns with regard to both the meeting timeframe and the EM resource updates for bed availability? Okay. I'm going to say silence is concurrence. We're going to move forward with this. I will push out an EM resource high priority announcement today that states that this is the way we're moving. I will now inform our house here as well and over at Shiloh, but that's how we'll move forward going forward. All right. I'll jump off of that bandwagon of COVID and then I got you, Molly, and allow Greg to give us an IDPH update.
Good morning, everybody. Phil's report is a little more positive than I think. I know a lot of you people have been on calls that I've been on looking at numbers and our numbers look pretty grim, I think. Not only have we dropped below 20% in ICU beds, if you look at today's EM resource, we are slightly above 5%. We have 6 ICU beds showing available in the entire region. That's from all of EMS, basically, EMS Region 4 down in Randolph County up north, and that's pretty small amount of ICU capability for us to have. We have 32 ED boarders, which is a little bit better than it was day before yesterday, but our numbers are spiking quickly, and it would be great if it all ended tomorrow, but I don't think anybody is positive that that's going to happen. So as Phil said, with the EM resource going to twice a day reporting, it's going to be even more important that those numbers are accurate because it will be very difficult to find places to put these people if we run out of ICU beds completely. And I know St. Louis City is struggling with those issues as well. So we don't have our friends across the river to fall back on. So just be aware that the entire state is in the same situation. We were a little bit behind catching up to that level of infection, but I think we've reached that point now. We've joined the rest of the state. So everybody just please make sure that you are touching base with your people who put these numbers in to try and ensure that they get put in timely and they get put in accurately. And Phil, that's all I have.
Thank you, Greg. And and for that update, I'm going to focus specifically on the availability. So you won't have to fill out the rest of everything else, capacity surge, but we'll look at availability and ED borders are really what I'll put in that note. So hopefully that will limit it down, a bit, and may go as far as just limiting it to ICU, med surge, and ED borders, because that's where I think the lion's share of it is. I'm not really concerned with the OR beds you have available, your decon throughput, all those things, but those 3 key indicators, med surge, ICU, ED borders, are the most important, at least from what I understand, unless someone else objects. I'm gonna try to keep it as streamlined as I can, but I definitely want those 3 key indicators. Okay. All right, we'll move over to Beth. Beth?
Good morning, everyone. I really don't have a lot to add. I think everyone knows the numbers are going up. I know the health departments are struggling with new cases. The IDPH is onboarding a new system where the contact tracing will be more automatic. I think that's supposed to switch over on January 13th. But we have had some issues with it. Hopefully, we're seeing some corrections with that. The other issue, of course, is testing. Everybody wants to get tested, and we all know there's a shortage of the rapid tests. We can still do PCR, but sometimes the turnaround time on that is not good. As far as Missouri, their numbers, of course, are right up there, if not higher than what we're seeing over here in Illinois. I hate to use the word grim. I know that that's been mentioned on a few calls that Greg and I have been on the last week or so. All I can say is we just got to keep vaccinating, and like I said, I know I'm preaching to the choir. The other thing that I'm trying to find, but it's a little lagging, is I believe that at least in Illinois, a lot of the cases that we're seeing are not necessarily Omicron, that we still have quite a lot of Delta out there. So don't just assume that everything is the Omicron. And that's all I had, unless someone has some questions.
Beth, we did receive a few questions, or I won't call them questions, but concerns with regard to folks, I guess the messaging that's been out there. And I know it's, sometimes you have businesses that have their own sets of rules and the state has their own sets of rules, but there's been a lot of talk about businesses that have been requiring staff members to come back with a negative test before they can be returned to work. How are your departments feeling that or seeing that a lot? And is that, and I'll just say rumor mill, is that what's causing some of the congestion or the additional testing that's occurring at some of the public sites?
I don't have any hard data on that. Just ancillary data, I guess, would be most people, as I understand it, want to get tested for their own reasons, for personal reasons, for wanting to go visit family, or because they were contact with someone who was that did turn positive. Having a negative test, as far as CDC goes, as I understand, is still not recommended or required. It's suggested if you can get one. But the problem is, if you're on day 5 and you get a PCR test, by the time you get it back, you're almost out to day 10 anyway. There's also a lot of evidence that if someone does test positive, after about day 5 or 6, they really are very not communicable. They really are not shedding much virus at all. I also will say that based on some CDC calls that I've been on, CDC is considering that 5-day retest or testing if you're a positive case, but they haven't committed to that. Again, testing shortages may sway their decision too at this point. Long answer to a short question, Phil.
No, my question was kind of long too, so no, I appreciate that, Beth. Thank you much. Any questions for Beth?
I do, Phil. John Nowak.
Go ahead, John.
Just, I check on our health department, since we do provide the EMS for our St. Clair County Health Department, but I keep a pretty good eye on the Fairview. Actually, I just drove by there 20 minutes ago. Our mass testing and vaccine clinic there, and it was packed. Beth, do you know how many, and I mean, this might be a crazy question, but how many people are we testing, are having requests from for testing our vaccine from out of state? Because when I drove by the clinic up there in Fairview Heights, probably at least 30% of them were in Missouri plates.
That might be a question. I can find out. I do know, as I understand it, that the Missouri is not doing much state-sponsored testing right now. They've kind of backed away from that. But you got to remember too that St. Clair Square is a PCR test, as I understand. But I can find out.
I was just curious because, again, I also watch our numbers from you guys, from you folks, from IDPH, and seeing how many Illinoisans are vaccinated. And I keep thumping my head going, well, there's only 10 million of us. Why are we showing that we have, 14 million vaccinated? It just, I don't know. I'm trying to figure a way out of this hole, between the short staffing and the testing. And so I know it's all craziness, but it just blows my mind when you actually try to sit down and you look at numbers and try to put those numbers and try to analyze those numbers to try to get an answer. I just can't come up with one.
Yeah, I understand, John. And there's people a lot smarter than me in Springfield and Chicago that are running those numbers to try to get us some answers. I will also say that as we've had that conversation multiple times over the years since we are so close to the metropolitan area. And as we all know, the disease does not stop at the river. So we've always had the, I guess, the gentleman's agreement that Missouri and Illinois, and especially in the St. Louis metropolitan area, will cooperate with each other and vaccinate or dispense pills or whatever the event is, that we're not going to worry too much about where the people live or work, because we want people in Missouri to also get vaccinated and tested, because it's not going to stop at the river. But I agree with you, John, and I'll see what I can find out about some of those numbers for you.
Thank you, ma'am. Again, I know what our poor health departments are going through now with the testing. The county that I actually live in has suspended testing, or, the rapid testing anyway, just because it's such demand. So, okay, I'll stop.
Right.
Thank you, though, Beth.
This
sure.
is Paula with IPHCA. I'd like to interject too on the testing piece, to be connecting with your FQHCs in the different service areas. That there is HRSA is launching a new home test kit where all the FQHCs are able to order a large amount of home test kits. That is the Quiddle Quick View at home COVID test. It's available for asymptomatic or symptomatic persons within 6 days of symptom onset. It can be self-administered for 14 years and older. For children 2 to 13, it can be administered by an adult to them. And they're able to order these. I know with the holidays, there's a delay. If the FQHCs have ordered them, there's been a delay in them receiving them. I've not heard of anyone for sure that's got them yet, but they'll be able to place weekly orders, and it's fairly large supplies, and it's designed not just for their patients, but for the community. So definitely be talking with them about, creating a plan for dispensing of those home test kits. I wasn't sure if everyone was aware that that was something that was being launched.
Yes, ma'am. It's
Hey,
John
Paula,
Nowak,
this is-
MedStar. Hey, real quick, I'm sorry, Beth, I'll let you get your question in. My question to that is, yes, we've been watching that. But help me out here. Is that not a test that you swab yourself and you send it in to get the results?
it's
Or
a
is that's
no, results in 10 minutes.
okay, good. I'm glad to hear that.
Paula, I was just going to say I've been following that too. If you have something you want to send out, if you could send it to me, I can send it to the health departments, or maybe Phil can send it to everybody. But yeah, as I understood, they were supposed to start this month.
Yeah, so I just logged into our portal to kind of look to see if I'd heard, like, because they were talking about some deliveries, and there was a couple comments that they were expecting shipments 7 to 10 days. They ordered, the last shipment that you could order was on the 30th, and people haven't received their shipment yet. So I think some people may have received some, and some are still waiting on that first, but then they'll be able to make weekly orders. So I think, working with the local FQHC and anticipating numbers that they can, in that you're willing to help distribute in the community to different partners, is what HRSA expects. They don't expect them to do it all on their own. They expect them to network with their community partners to get these test kits out.
And Kim,
Great. Thanks, Paula.
Kim Lampert has
and
a
if you haven't-
question in the chat. Asking what was the name of the test kit specifically again?
Sure, let me look that back up. Quiddle, Q-U-I-D-E-L, QuickView. What was that?
I'm not sure. I think we had some just unmute.
Okay, that's okay. Sorry, I'm on the phone. I wasn't able to get the login to work. So Quiddle, Q-U-I-D-E-L, and then QuickView, with the view, V-U-E, at home, over-the-counter COVID-19. And if an FQHC that's in your area, if they've not logged in or they're having trouble, not sure how to be a part of this program, have them reach back out to me. If it happens to be a partner that's across the state line, this is a national program. If they're not sure what to do, you can still have them reach back to me, and I'll connect them with their PCA in Missouri. We really just want to make sure that every FQHC is aware of the program and is participating in, getting these test kits out to the community.
Thank you so much. Okay. We'll go ahead and move on to our STARS family. I know I got Dale's name still here. I apologize, but STARS?
Hey, it's Sam. I'll go ahead and go first, and I know Brian has a couple updates too. So I'll toss it over to him after. A couple of things I wanted to update on were we did finalize our IPP. So we are looking at, currently it's listed as a 3-year plan, and we've talked about moving forward. We're going to expand that into a 5-year plan just to allow for some more time to do planning, especially with UASI grants being 3 years. It allows us to kind of look a little bit further into the future of what those training and exercises may include application-wise 5 years out instead of just 3. But a couple of just brief highlights I wanted to include on that is we did determine 8 focus areas in that IPP, and one of those being healthcare preparedness. So we're in the beginning phases of really looking at making a lot of those hopes and dreams in our IPP come true. Starting to organize, putting together maybe some exercise planning groups, and looking at how to bring some of the training in. So I'm sure we'll be in touch to kind of help coordinate that and not duplicate any planning efforts or anything, and then also to include invites wherever we can in all of those activities as well, to kind of to share that wealth and that knowledge and capability. So that's one thing that I wanted to say. Other than that, on our end, for the STARS UASI, we've completed our THIRA SPR plans, and everything has been submitted through the state of Missouri. So kind of a good wrap up to 2021 and moving forward into all of our plans for 2022. Brian, I know you had some updates.
Yeah, I just wanted to bring up.
Sorry.
Go ahead, Sam.
Oh, I've completely forgot. I was going to also bring up that the SMOC also did yesterday, I believe, we had an after action meeting to talk about the Edwardsville tornado. And so that went well, and we were able to kind of put together a lot of notes and come up with an after action to move out of that. So I'm sure that there will be more to come from that meeting as well. Sorry, Brian.
No, that's okay. I was just going to bring up that the UASC next year's grant, the fiscal year 2022, should be coming out for notice of funding opportunity in February. So in February, we'll get that notice. We will start releasing the applications so that STARS committees can enter into projects, and then we'll do a competitive process. Normally that process ties up by about April, and then April or May, we'll have to send that then in. That grant is anti-terrorism, but there is some overlap there, obviously, with healthcare, EMS, et cetera. So I encourage everyone to watch for that upcoming, and contact your STARS committee leadership, your chairpersons, if you have any questions on the application process as we start that. Thank you.
Thanks, team. Any questions for the STARS crew? All right. We'll move over to Remart. Mike, do you have any updates for Remart?
We actually have a lot of movement stuff going on right now. After the Edwardsville incident, some of the partnerships that we made during that with WashU EMS Fellowship and stuff has kind of flourished, and we are doing a lot of talking with them on how they can support us in the future and stuff that they can help us with. So we're working on a lot of education pieces right now that are going to be moving forward.
Okay, thanks, Mike. Any questions for Mike regarding Remart? Nope. Okay, we'll move on. I don't think we have Sue on, but I think just bad timing.
I'm here. I'm
oh,
here.
Great.
Hey, no, I don't have anything on mental health.
Okay.
Other than we were waiting to connect about the pediatric concerns we had last time.
Correct.
I haven't heard anything on that.
I was trying to give Dana a little bit of time to kind of reconvene post holidays. Just I think it was tried to rush through a few things, try to get it started before the holidays, but he's definitely on board and has some ideas. We will be establishing this process as, I guess, a subcommittee to the coalition itself to kind of focus on some of those areas we identified last month. So look out for more information to come on that and the upcoming meetings. We're going to try to get that into a battle rhythm, hopefully starting next month. So please be on the lookout for that.
I did meet with virtual meet with Children's and Cardinal Glennon, and I have some guidelines that they offered up that we could take a look at in a subcommittee to offer the region.
Awesome. Okay. Eric, any updates on pediatrics?
There's some the state's disaster preparedness committee on pediatrics that I sit on has put out. They've been finalizing some guidelines. There was a vote on some new established standards, but nothing has going to be published yet because I think they're going to try to relook at it as it dictates with what's going on within the state. So I'm waiting to see what comes out of that. At some point, though, we need to start probably looking at a regional pediatrics committee. I know that we had some folks that were chairs of it, but we need to relook at if those meetings are still being continued, so that we can determine whether or not we need to change folks out or what have you, or if it just, something's just kind of, died on the vine. So I'm kind of looking into that. Other than that, EDAP, again, we still got to try to get hospitals on board to, get EDAP and the pandemic is kind of bringing some stuff to light. I know we are stretched thin across the hospitals with our staff, and taking on small people is sometimes not the thing that we want to do when we can send them across the river. But those folks across the river are swelling up too, and that means those pediatric populations now have to go somewhere else. And I don't know, sometimes I'd rather absorb the small people population by making our EMS guys drive to Springfield and Chicago to dump them off and putting EMS crews out on the road unnecessarily. So if you have it in your wheelhouse to do EDAP or attempt to look at CDAP, it's something that we need to think about so that when we do have issues where, we have a rise in numbers, that we can take on what we can internally before we start shipping things all over the place, and then we turn EMS into FedEx and UPS. So that's all I got, Phil. Thank you.
Thanks, Eric. Any questions for Eric? Okay, hearing none. Quick grant status update. So we're now preparing the subawards for those who did submit project requests and have approved project requests. We're about 3 to 4 weeks out from you guys having those and being able to commit funds. So this is good. We are light years, I feel, ahead of previous years. So please be on the lookout for that. You will probably, if you don't see the email from me directly, the email will come from Lisa Howell at BJC.org. She's our new Christina/Sarah. So she's managing all of those subawards as well. So when you get that subaward information in your inbox, please, get it filled out as quickly as you can, the questionnaire as quickly as you can, and get that sent back so we can get you on the road to spending those funds and executing those projects. I have on here FY22 Executive Council. I mean FY23. The project requests for the FY23 projects, we closed those last month, so I'm consolidating those and we'll be sending those out to the executive committee for review and prioritization. I think we received a total of 10 project requests, so shouldn't be too difficult of a list to manage and get through. So I'm gonna give ourselves about 2 weeks. So I'm gonna try to send that out next Monday, and you'll have about 2 weeks to review those. And then we'll have that ready and prepared for updating the FY23 grant when that is open and released to be when the NOFO drops and we're able to fill out all that information inside of eGrams. Also, I just kind of threw it on here. I'll be finalizing the coalition assessment tools, the CAT. I kind of head up filling out it's basically, I don't want to call it a capabilities assessment, but it's a blend of capabilities assessment, questionnaire, a whole bunch of stuff. I normally fill that out and provide that to the executive council for review. And if you see things that need to be changed, please let me know and I will update those. But I'd like to get that knocked out and updated back in the CAT as soon as possible. So please be on the lookout for that for the executive committee. A quick update about EM Resource. You probably know some of you know there was a no notice drill. We do 6 of them each year. They're normally we do in the form of the MCI drill, and they're part of our redundant communication drills that we have to do as a part of the grant. We would be doing them anyway, but there's kind of 2 phases to these drills. Well, the one that went out yesterday, I had Lee and I kind of program them out at the beginning of the year and do random dates and times. So the one yesterday went out, I think, at 5 in the morning. And these are just a quick summary of what was received. So 7 out of 19 hospitals actually provided, red, yellow, and green, updates, for that MCI. They were able to go in there and say, I take 5 reds, 10 yellows, 10 greens, or what have you. 6 of the 19 updated 000, and that may be the right number, because if we have some of those organizations, those borders, having a bad border situation, you may not be able to take anybody, and that's fine. But sometimes that can be an error. Some folks get that and they don't know what to do with it and put in 000. And the other 6 of the 19 did not update. And I'll just say, I'll be transparent for us. Memorial's one of those. I've included in an email that went out to you all this morning, right before this meeting, a copy of these slides and a copy of that drill itself. So you can kind of look in and see if your hospital organization did or did not update appropriately. I say all that to say this. While I don't update those numbers because I put it in there as something that I'm sending out. So if it was real world, my expectation is that my ED charge nurse gets that notification, or someone in the ED gets that notification, and they begin, tallying up what they can submit, and they get that in there within 15 minutes of it going out, kind of how our plan is written. But what I found out yesterday, as me and Greg were talking, is that I was like, I didn't get that message. I was kind of freaked out that I didn't get the message yesterday, but I did get the message via text. But I am suffering from message fatigue or alert fatigue. Why? Because I've updated my EM resource notifications to for certain organizations or for certain things within EM resource. I'm basically getting bombarded with status changes right now. So if it happened to me, I'd say it can happen to almost anybody. Not that I'm perfect beyond any means, but I really, every time I get an EM resource notification, I normally look. But this happened at 5 in the morning. I woke up at around 5. But the first thing I saw was a status change, and I think it was maybe Anderson's going off of peak census. I believe that's what it was. But there were 3 other status change notifications on the amount of ED boarders at a particular hospital. So I suffer myself, at least right now, from EM resource notification fatigue. So I'm going to readjust and recalibrate my notification preferences to ensure that I don't miss something that I shouldn't miss on that time frame. And while it is an exercise, we do have, some of the good folks out there that really rely on that information. I'll cough John Nowak's name probably in the background somewhere. And when they see that, when they see those notifications go out and they see that some folks haven't updated, they're like, hey, are you guys paying attention to this? Da, 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 da. I know it's a drill, but that is what I would be using in real world, as we saw during the Edwardsville tornado. So just a friendly reminder to everyone, make sure your preferences are up to date. Don't suffer from message fatigue like Phil. And please make sure you got folks who have 24/7 access. So any questions on that? Okay, hearing none.
Hey,
Oh,
Phil.
go ahead.
John Nowak's got to say something. Yeah, 506, buddy, is when I received it.
All right, that's about right.
One thing something that I have learned over the years is that I have the notifications like you, and you're right, man, you get so many different alerts for different changes that sometimes you have. One thing that I was able to do, and I can't remember how I done it. I can't remember if it was through my actual phone, but I think it was through my preferences. I changed the tone only for MCI alerts. So I have a weird tone, and that woke me up out of my sleep because I heard that tone. Just throwing that out there. I do believe you can change the tone for different alerts that you want.
Oh, well, that's awesome. I'm gonna take a look at that, and if I can figure it out today, I'll try to put something together and just throw it out to the group so maybe someone else can benefit from that. But that's a good idea. So thank you for that, John. All right. So as part of this, you see the words redundant, okay? Redundant communication drill. In previous redundant communication drills, what I would ask folks to do is go in and maybe I'll put a PDF inside the notification. You see it in EM resource, so check one box, and then I want you to email it, because as a part of our TICP, email is a form of communication that we use to communicate with each other. And email that to the rhcc@swillhope.org, and then we can report on and say, okay, this many folks were able to see it, this many folks responded to the EM resource request, and then this many folks actually sent something to that account. Now, what today I'm going to ask everyone to do is I'm testing both sides of this. So there's 3 methods and mediums today, or starting from yesterday, is EM resource, our other communication drill, or other communication portion, which is Microsoft Teams, and I'm going to ask everyone who has a, and I know who you all are, who are on here today that have an active D4H account. And if you guys don't remember what D4H is our common operating picture that has an active D4H account. Log in by close of business today and just post a status update in the log, and I will show you what that looks like here shortly, because I'm going to give a kind of quick demo because I want to talk about one other thing. But this is all a part of a single drill, and I'm trying to keep it as low brow as possible, as to not make folks have to do a whole bunch of crazy things, because I know you're busy. But this will be a simple one, so you'll be able to just log into D4H, and I'll show you how to put in an update on the log. So that way we know you got one, you have an account. And if you are on this call and you are a hospital, EMS, or state agency, and you do not have an EM resource account, and you're part of our region, please let us know. And that includes our STARS partners as well. So we want to make sure that you guys are taken care of. So if you don't have an account and you feel as though you need one, please shoot an email directly to me and Lee, and we will get you established. Okay. I will open the floor by starting with a quick demonstration of two things that we're currently talking about. So I'm going to share my screen, and this will go up obviously on YouTube, so we can take a look at this later. But I will share my screen here, and I'm in EM Resource now, and I want to go to, let's minimize that. I want to go back over here to D4H. So here's D4H, and I will go all the way out. This is what you'd be logging into, and you would go in here to the regional pandemic response. Two things I'm going to cover. One, how to finish off this drill. All I'm going to ask you to do is go to the log of events, and what it's called is basically updates. So you can see where it says log here, it says updates here on the left. So if you click here, or if you just click this update side, you can put an update in here. As you can kind of see, this is some things that we've been knocking out. We've been providing some resources to some of the teams or some of the organizations here, specifically ventilators. And I put a note in here for Randall that he can pick up his vents here at the RHCC and give all the information to do so. And that's quickly done by just going in here and typing a message. And just like you probably on Facebook, Twitter, or whatever your social media platform you use, and you can say, Randall can come in here and say, on my way, should be there at 1300 hours local. See you soon. And he can hit the little @ sign, and he'll get a list of folks to pop up, and he can either type my name, or what will get it to myself, Lee, Eric, and everyone, he can type in regional hospital coordinator. If you can see that right there, regional hospital coordinator. If you were to put that in there, it will go to all 3 or 4 of us. So that's how you communicate on here. So when you guys log in, and everybody has a D4H account that has access to this channel, which is our pandemic response, you can just come in here and just put D4H account is active, and then you can put the @ sign and do regional coordinators. Okay, so that's what I'm gonna ask you guys to do before close of business today. Second thing that sounds like D4H is resource requests. So again, just as a friendly reminder, the resource request process here. Oh, nice, very nice. Anyway, okay. You go here to the HOPE resource request, find your organization type. So if you're an EMS system, health department, or what have you, we'll just say hospitals, and you want to request a ventilator or whatever supply. First, you should have exhausted your capability, contacted your resource hospital, and preferably your resource hospital should contact us. Now they can give us a call, but that official request is going to get logged in D4H. Okay, definitely give us a call because that way we can let you know if it's there or not there, and if we need to go to the next level. So if you say I need circuits for you pick the type of ventilator, and I go, well, I don't have those circuits. We still want to document that you requested it. Yep, you gave me a call. I want to document you requested it. But this also, that documentation, now we can come back and say, yes, they asked for this. The region can't support it. Now we can send that up to the state through the local EMA. Okay. Somebody else's resource request is active. There we go. And I've got 2 notifications of that. So you can see that this is working as far as it should. So to get that resource request, you would go ahead and click the add button. It will pop up with the form. Okay. You're a part of the hospitals, so that's where it'll be filled. But if you clicked in the wrong one, you could change it, but we'll stay with hospitals. Okay. You would click right down here. I need 1. And you can select the unit of measure, case of medical supplies, and you can say saline flushes. On here, total, you said, need 100 each is required. And if you need to add multiple things, you just click this little plus arrow, bing, and it will just give you more and more lines. You can kind of put in the reporting location, where you're from, any suitable substitutes. I can take this over that if you got it. Put your agency information in, what priority it is, routine, low, etc. And the rest of this is very straightforward. It's basically a carbon copy of a 213 RR ICS form. And as you go down through here, you'll get to this location here where it says staff, logistics staff assigned. And this is where you want to attach it to the RHCC. So again, preferably this should be a resource hospital. So I just would put, there we go. Go down here to a regional hospital coordinator. Boom, boom, boom. And that will get to us, put in your date and time, and we'll pretty much print out the rest. When you get here, we'll have you sign it, give you a copy, and that's it. Yeah, because this will go directly from here to print to PDF, pops up, and then we have all that documentation. We'll have you print and sign. We'll keep a copy. You'll have a copy. So it's pretty straightforward. I'm going to delete this one because I'm not going to submit it. Yep, that sounds about right. To go back. Wasn't finished. Go back in. And that's under the regional pandemic response. Any questions about D4H? So I can see Danielle and Vicky have already made sure their accounts are good to go. Okay, hearing none, I'm going to stop sharing that. If you have questions. Go ahead.
How do you get to that again? I mean, what are you clicking?
Here, I'll go back.
So I'm in D4H, but.
Yep.
So where do you get to this updates tab? What do you have to go across the top?
Are you here right now? Are you on this tab right here? Are you, if you can see the screen, can you see the screen, Greg? Sorry.
I can see your screen.
Okay, so you've made it to the regional pandemic response portion?
Yeah. Oh.
So
how do I, because what I'm seeing is a bunch of windows right now under the dashboard.
You see this right here? Yep. Can you take a look at my screen again? You probably see a dashboard with a bunch of windows, personnel, stat rep.
But see, I'm not seeing these things on the left-hand side. I'm seeing things.
Oh, it's probably collapsed for you. I don't know. Are you on a phone or are you on a computer?
No, I'm on a computer.
Okay, so if you see in the top left, there's like a little hamburger daily job. That's what they call it, at least in the computer world. And that'll hide and show. And even if you can't get to this portion here, if you can't get to the side, you can always get to the log right here. If you just click on log, it'll take you into the log. As far as equipment requests, oops, let me go back. On our dashboard, if you see this, the requests here, you can click directly on requests here and it will take you to that same spot.
Okay.
So when you're on the
That's
dashboard,
nice. I'm a waste of time. I'll get with Lee and he can walk me through it.
okay, no problem, no problem. Any other questions? So hearing none, I'll say I'll just open the floor. Any general questions, concerns, needs? No? Okay. If we don't have any, I think the last things that we do have is we're canceling our February 9th decon training. And unfortunately, we have to cancel that one because we here at BJC are now limited to conducting face-to-face or in-person trainings. We're going to try to, we have to submit, and this just happened just the other day, we have to submit an SBAR to get some of those approved, but just given the amount of work that everybody is currently under load, the priority is patient care with regard to COVID. So we're going to cancel that class. And because Omicron is super catchy and super spready, we don't want to put a bunch of folks in a room all at the same time, masked or unmasked. You're going to put on a lot of PPE. It's going to be a lot of touching. You know how it is in decon training. So we're going to try to avoid that this month, and we'll probably just have to pick up. Hopefully, we can pick up in the March timeframe, but that will only be, COVID pending, I should say. All right. If we don't have any other questions, concerns, needs, or anything, we're going to close it out here. I appreciate everyone's time and consideration. Stay safe, and we will see you on Groundhog's Day next month, February 2nd. Take care.